without any further ado, I'm going to hand you over to Rupa now.
Thank you very much.
Massive round of applause, please.
So a slight change in role title since I made the submission. So I'm Associate Director with the Southwest Academic Health Science Network. I'll tell you a little bit about what we do there, but really I'm here to talk to you a little bit about what I think is major potential in digital health and social care, actually, I should say. So in terms of the, hang on, she says, because it's not set up to do the slide. There you go. So, in terms of the Academic Health Science Network and the press play that I've done, we are funded by NHS England, Office of Life Sciences, and NHS Improvement, but NHS Improvement has become part of NHS England. So we are our own entity. We're based in Exeter, in Vantage Point by Pines Hill. And really the ask that comes from the government to us is we have a lot of innovation. It is estimated that it takes roughly 17 to 20 years for innovation to enter the NHS and social care sector. Can we make that faster? So that is really the challenge that has gone across to lots of people. And we're not the first, we won't be the last, but we are currently playing that out at the moment. There are 15 of us in the country, and when I say the country, it's England. So there are equivalents in other parts, like Wales and Scotland and Northern Ireland and Republic of Ireland. We would all work closely together, but see this as an England venture. From our perspective, we're not England boundaried, we're not Southwest boundaried, but we work with 14 other academic health science networks across the country. That's relevant to you if you're working in health, because depending on which part of the country you're trying to make an entry into, there might be an equivalent of us who will help you. So really, we will talk to them, you can talk to them directly, we're here to help. That's the kind of message I wanted to first give you. But I wanted to understand who in the room actually already works with NHS and social care. Very small. Who would like to get into digital health technology world? Who thinks it's a near impossible task in what you know and what you would like to do? Brilliant. So all of you have an aspiration in some way, or some of you have aspiration in some way. I would argue all of you have something to give to health and social care. And that's partly why I was really, really keen to give this talk. Because I think, and the people I've met, so I've been in the role since last June, and before that, I've been within that kind of digital technology conversation probably for about 15 years. I was one of the first few people who sat in Tech Exeter meeting at the Phoenix when there were a few of us sitting in a little chair and wondering what this network is going to be like. And it's an amazing network right now. So it's been an exciting place to get to. Actually, looking back 10 years ago, as Chris said, if you went back to my 10-year ago self, would I have thought FutureSync is where I'll be standing today? No. Would I have thought Tech Exeter and all the digital communities in Plymouth, Cornwall, Taunton are doing what they're doing today? No. But we are in a really exciting place. From an AHSN network point of view, what we are doing is to try and understand what we can do to help you enter the health and care network. So if I say a little bit here, in terms of how we work, this is the innovation pathway that we look at, and it's really saying everything starts here with the ideas, the culture, the context. A lot of this is about context, but what we're doing in that situation is helping you make the connections, and I'll say a little bit more about that, because that's why I talk about the people and the potential, because everything, and Chris has already alluded to this, you will not get there by sitting behind your computer, you will not get there by being in your room and doing something incredible, because that incredible will not get out. And that is really why we exist and why our team gets excited about it, because we meet so many people who I'll introduce you to some of them who have incredible stuff going on which will change the way in which we deliver healthcare today. But we know they're on a journey of 5 to 10 years, and if we don't help them right now, they may stop that journey, and that's what scares us. And that's what would scare me as a mum, that's what would scare me as someone who wants to see that benefit come through as well. So we spend a lot of time here, and then there's that kind of technical bit in the middle where you might want to talk about IP, you might want to talk about what it's like to have a medical device, you might want to talk about the evidence that you need to get in there. don't try and get in there without the evidence. That's the key message for health and social care. There are ways to get evidence faster, but don't try and enter without the evidence. And then you're into that commercialisation adoption. Adoption is where we really get excited, what it feels like in the context to actually go and make a difference. And we have various pathways, and we work with the Billions Institute in the US, who talk to us about large-scale change. They've just done some training here in March, and they'll come again in September. So there's a lot going on at the moment that we are getting excited about, but we would love to have you involved. So for example, tomorrow there's a webinar talking about funding opportunity. I4I, does anyone know about NIHR? Yeah. So the National Institute of Health Research is the biggest funder of health research in the UK. They are one of the biggest funders of health research in the world, in the sense that what they're doing is bringing together a lot of money and then pushing it out and saying, you're a researcher, you're a business, you're a this. They don't usually go for businesses. That's the reality of NIHR. If you know the trick, you can play the trick, you partner up with a university. You partner up with a university usually a year ahead of that application coming through. Somewhere along the lines, people like us get signals from these institutions that say, we think we're interested in this topic this year, cancer. So we're currently in discussion about topics that are of interest for next year. You will see the application next year. But we're in discussion, we can give you signals. So these are the kind of webinars are an example of what we do as well. So a lot less about us and a bit more about the people. So I wanted to share stories really. So just to give you a flavour, let me just see. This one is in the marquee where you're having your exhibition at the moment. So we were in Plymouth at the end of January. Pepper, has anyone seen Pepper, the robot? Yeah, of course, in Plymouth. Pepper's very famous. Pepper was there that day, and I was really excited because that was the first time I saw Pepper. And that team was really coming together to help solve challenges that we worked with the health and care sector to bring together. So there were clinicians in the room, there were students, there were guys like you, and we were really saying, today, can you help them think something through? And that is really the relationship building. So what I bring to this conversation today is, if you can join these things, you start your relationship building. If you can join these things and give a little nugget of your expertise back to the system, you might find that relationship that gets you to the NIHR application in about a year's time. And the thing I love about NIHR applications and Innovate UK applications and all that kind of money, they're hard to get, but once you got it, that income is secure, really secure. 3 years, 5-year projects and NIHR applications, £2 to £3 million, they cannot take you out of that application if you're built into it. No one can take you out of that application if you're doing a job that you said you would do. So that's great amount of security that comes through. So this is a digital health accelerator that we're running at the moment, and Victoria here, just seen a tweet just now, has been named by AppTech Nation with the list that went to Forbes as a social good entrepreneur. She's got a social prescribing platform. She worked in Wales really hard and then brought it over and is part of our accelerator here. So she's doing an amazing job, and that's part of my team up there at TEDx Exeter. We get out and about because it makes a difference. We tried sitting in the office and it didn't work. So the whole thing around relationships, massive. But the thing is, and this is news from yesterday, University of Plymouth with their Epilepsy app won another award. So this stuff is happening in our patch. That is what is so amazing about it. The thing is, people go out of their way to make something happen. And I wanted to tell you a little bit about Amy. Amy, I met through telephone around July last year. 2 days ago, I met her on a conversation about going national with her app. So her app was already in development when we met her, but she has come up with a solution that makes it easier to connect two groups of clinicians, the approved mental health practitioner that is needed with the doctors that are everywhere, and it's a communication tool. She came up with that app because she was a social worker who was really upset about the fact that she couldn't find the doctor on time. The difference it makes is that if I'm in a mental health crisis and need to be sectioned, I have to go through this process, which is horrible for me, but this app will hopefully make it faster. It will hopefully make it faster to connect two people who, or three in this case, clinicians who have to come together to say, you can section me, detain me, and take my rights away. Really horrible process to have to go through. Amy was feeling the pinch of it as a clinician went to develop her, developed it, and now she's going national. She's covered about 46% of the country with her story, and she's about to hit contracts in a very short space of time. She wanted to solve a problem. I wanted to tell you about Amy because it can be done. It is a really, really hard story, but it can be done, and she's worked really hard to make it happen. And for me, it is about bringing the designer, maker, and the user together. So she brought those things together. She was the connector, but you guys have one of the magics here. Even if you're not the user, you're a designer or a maker, and we'd love to hear from you. The reason we want to hear from you is we keep hearing about the user stories. I have been fascinated sitting in panels like the kind of Innovate UK panel where you think it's cutting edge technology. It's really cutting edge technology that you're going to give £1 million to, isn't it? Is it? Has it always got to be cutting edge technology? No. It's got to be reliable. You've got to come across really well. And it doesn't have to be cutting edge. So the immersive experience doesn't have to be virtual reality for it to work, but it's got to work. That's what you're convincing the panel about. And then they come back to, are they going to benefit from you? They being the clinician or the professional or the service user or the patient. They holding it in their hands or using it. Are they going to benefit? Really, that's what the panel was considering. At the end of the day, when you hear them go back and forth in their conversation, I was fascinated because I always thought you don't apply for those £1 million applications until you've got cutting edge technology. No, have cutting edge application of a technology and you'll get there. So the user, we bring them together. They come into the same rooms. The innovator, the user, mum and her daughter. This is a maternity and neonatal safety meeting that took place in Exeter. The innovator came in, the clinician came in, the user came in. These are potential connections for you, and we can get you into that room. If you have ideas, or you're not sure where your ideas could go, or you're not sure where to get started, come into a room with us and we'll get that started. And that's the invitation to all of you. You can all ping me a message and say, I think I've got skills, I'm not really sure, but can I get involved in this world? And it is very, very easy for us to do that. The next steps, I'm not going to lie about it, it's really hard. You've got to have patience, you've got to have determination, and you have to have gut to take part in the health and social care sector. And there are innovators we meet who are at the tip of going, I do something amazing, why isn't someone listening to me? It is not going to be easy, but we can connect you. So don't sit there alone thinking that it is impossible to meet these users, clinicians, and those people on the ground who actually can help you develop something. So I said in my abstract, I'll tell you a little bit about NHS App. NHS App, any of you using it? Very few. Anybody helping to develop anything for NHS App? Not yet. So if you're trying to develop personalised health records systems, if you're trying to develop prescribing systems, too late. But if you can build things that goes into the NHS, I say too late because there are already players out there making these connections. So you either got to come in with something amazingly different or it's too late. But there are connection opportunities here. So NHS App is basically the app they all want us to have on our phones. And it's going to launch, it is out there at the moment. If you download it, your GP practice might not be participating, but it might be very shortly because that's the push. So by 1st of July, the push is that you will use the NHS app, but it sits all within this story of digital. So every NHS plan and local authority plan talks about digital first. Digital first for your outpatient appointment, digital first for primary care, digital first for the community care that you're going to receive. Your GP needs to go digital first. These are conversations that will start to enter through NHS App. You don't have to have an amazing technology idea to start this conversation, but just don't touch the areas that are already covered by it. So they're trying to make it so you can build to it and talk to it. And so there are opportunities there that I would definitely highlight. And I also wanted to, and if you're thinking about from an app and website world, more from an app world, if you're thinking about entering that, it's well worth looking at the NHS Apps Library. Anybody heard of the NHS Apps Library? At the back there. So NHS Apps Library is worth a peruse because it will show you where the different technologies sit. It is quite an application process at the moment to get through it, but they are getting through it. So it's by no means the signal of what's out there that's the best. It's a signal of what's out there that is getting through the application process, and also in terms of prioritising the specialties, the areas that people seem to want to prioritise more. So from that point of view, it's well worth you visiting that. So, and if you're not sure how to get all that information, just talk to us and we will make sure that you know what's coming. So I talked about the potential. So I took you through a little bit of it. That corner there, I think that was this morning's news or yesterday's news. Care Quality Commission is our regulator. They're the ones that make sure that you're not going to get a massively bad experience or care when you go somewhere. And I say massively because they can do the requires improvement right through to outstanding. But here's a hospital that has now witnessed what it's like to still need to improve their care, but they've been rated outstanding for their digital. So we're starting to see a place where the regulator is starting to go, what are you doing for digital? And the difference that makes for you from a business opportunity point of view is, am I going to help this trust do better for digital? And if you are, they're listening because the regulator's listening. Can you make a story about your innovation idea that makes it better for them? You may not know what that looks like right now, but if you have a skill set that you think you can apply to health and social care, we can help you work out what that might look like, because we understand that world really, really well. Local authorities have been given money for digital transformation. That means that they've been putting out challenges recently to actually work with them. Massively important area, massively trying to tackle vulnerable families, vulnerable people, that area. So we would encourage you to think about that. So don't always focus on NHS, go right through to the rest of it too. And this just gives you an idea. So anyone heard of NHS X? So NHS Digital was our go-to place when we wanted to talk about innovative stuff. NHS Digital is running NHS Apps. NHS Apps is our new health secretary's kind of little thing that he wanted to make happen. And I guess it's going to be like, I don't know, Google World of NHS. I guess that's what they're trying to make happen. We don't know enough detail, but we do know they're going to be a major player. So they're going to be a major player as to how you enter the NHS. So it's going to be an important area to watch, but it's not yet influencing anything that's happening. And so we're getting some insights into that. The companies on our Digital Health Accelerator are actually going to a presentation in the middle of May, and they're going to hear more about NHSX, and we can start to bring out some of the information back to you. So if you're thinking about entering that health and care field, think about having a look at what NHSX is doing, as well as NHS Digital. So I can get really excited about this, and I can tell you there's massive opportunities, and I can tell you that the Southwest is doing amazingly. Some of those awards that are being won and some of those development opportunities do come off the back of EU funding as well as other types of funding. And I can sit here and go, you know what, I could have told you that 10 years ago. I do think it's different. So I bring you back to the people story. And what I guess we realised as the Southwest AHSN team, looking at this, is that we're going to be good at connecting you guys to them, and that is what's going to make the difference. I say that kind of in an easy way. We know that's not easy, so we're going to work very hard to make that connection happen. We're going to make sure these events take place, that you get to meet them in their departments, in the context, etc. But what we think that will really do for the service in the Southwest is change the way people live their lives and people's health and care is taken care of. If we can make that happen and improve the lives of the 2.4 million people in the Southwest, we can take your story back national. People like Amy, people like Victoria, people like Richard, who work in these areas, Duncan, Dan, those guys I meet who are making a difference, actually started here, and we look upwards. We want to take your story up. So talk to us and we'll start connecting you. And we're in there for the long term with you for free. So we don't have any EU funding kind of restrictions that says we have to work with you this many hours, but we do know that you come in different shapes and sizes, and the kind of shapes and sizes you come with, you've kind of illustrated here, and we try to deal with all of those because we've got a massive network that we can plug you into. So anything from you're brand new, right the way to you already built it. This one, don't underestimate. When I talked about the £1 million opportunity, that's going from one industry to another industry. So it's called SBRI. SBRI Innovate UK funding comes around every year. There's another one about to be announced. And in that funding, you get £100,000 in stage 1 to test something. You can put it all to build, you can put it all to your tech, all of it can go in there. And then you go to stage 2 if you're successful, which takes you through to the £1 million. It comes with so few caveats. So few caveats as long as you do the job that you're looking to do. So this is very much about if you're setting out to change the world in which care is given, we can actually help, and these systems are there to help. But the main thing that you've got to remember, and we have always been trying to tell digital health, in particular technology companies, we work across the board, not just digital. Main thing we try to tell you is you can do lots of things, but focus it down. Think of that epilepsy patient. Think about that dementia patient. Think about that one place and one person, or that one professional or clinician that you could make a difference to with that broad skill set that you have. Get started there and then build upwards. Not, I have technology I can give, I can apply it anywhere. I recently had a conversation where someone said, I can apply it anywhere. And the person said, and this was actually a chief nurse in one of the big hospitals in England, said, I'm not interested anymore. I'm not interested. You can apply it anywhere. I don't know where you can apply it. You haven't told me. Anywhere is nowhere. So have a think where you want to fit in, and then have a think how you want to work with us, and I'll just go back and leave it there. Thank you.